Hi everyone, I'm Dr. Dushyanth Kalva. I'm a plastic surgeon at Inform Clinics. So in the previous video, I have talked about the differences between a bariatric surgery and liposuction and who should be going for what. So today in this topic, I'm going to tell you about what happens after a bariatric surgery and what can one do about it. I mean, a bariatric surgery patient can do about it. So most people think that getting a bariatric surgery done is the end result, but what they don't realize is it is only job half done, because after bariatric surgery there are multitude of changes that occur in human body. So there is, for example, there is a loss of humongous amounts of fat. Similarly, there is also loss of some muscle mass and decrease in bone density and some deficiencies of macronutrients as well as micronutrients. For most of the things are compatible, your bariatric surgeon would have already advised you and put you on supplementary treatments like multivitamins, mineral supplements, and a slightly higher protein diet, low volume higher protein diet, so on and so forth. But what most people are concerned with, say after 9 months of bariatric surgery, after their weight stabilizes, is sagging of all their body tissues. So to understand what is actually happening and why it is happening, you need to know how fat is arranged in our body. So most people assume that fat exists as an amorphous lump, like a wax in a candle. But actually fat is organized intracellularly. That means there are cells that store the fat. And these cells are actually organized like a cubicles in an almirah. Or more accurately, if I have to describe, it's actually like a honeycomb. Imagine your fat between your skin and the muscle being like arranged in a honeycomb, and the walls of the honeycomb are made of fibrous tissue. So what happens is when bariatric surgery is done and the patient starts losing weight, all the fat disappears and this fibrous tissue collapses, and then there is no volume to keep it stretched. So it's lost the volume and then it falls down, it descends, because this stretch it cannot go back. So it just descends down and sags, taking the skin along with it. So what people see is a humongous amount of skin and residual fat and fibrous tissue that is hanging everywhere. For example, in an arm it hangs like a bat swing, and then there will be a lot of multiple rolls in the torso, and then the penis is buried and the buttocks are sagged and the thighs descend down, so on and so forth. So all these things, if someone is not really bothered, I think good for them, nothing needs to be done. But unfortunately most people are bothered a lot and they start suffering physically as well as psychologically because of the appearance. They do hope for a much better appearance after bariatric surgery, but they lose the weight and don't come to their ideal body shape. That is where plastic surgeons like me step in by doing something called lifting procedures. They are post-bariatric tightening procedures. For example, an arm lift is performed for bat swing, and a belt lipectomy is performed to pull all the midriff up and tight, at the same time removing the excess skin. Similarly, for thighs, a thigh lift is performed. So I am going to describe each and every procedure in detail in subsequent videos. But what you should know is there is a solution for the kind of problems that are produced after a bariatric surgery. That is what the takeaway from this video is. Thank you.